If you're considering your Medicare options, you have two paths in front of you with two different risks. And that's what we're going to talk about next on Holy Schmidt.
Holy Schmidt!
Have you ever purchased the cheapest airline ticket for a flight? You know the one I'm talking about. The one where you get your seat assignment at the airport and you have to pay for checked luggage. And you're lucky if you get peanuts on the flight. And when you book it, it looks the same as any other ticket. Same plane, same destination, maybe even the same seat. And if you're lucky and everything goes as planned, you arrive on time and there are no issues. But what happens if your flight gets canceled? Well, as someone who's been on hundreds of flights, maybe more in my life, I can tell you, because I've flown both business class and economy and deep discount economy. That is the moment when you find out exactly what you purchased. And every restriction that you didn't think about comes rushing at you all at one time. The first thing that happens is you'll probably get automatically rebooked. Now, when people say automatically rebooked, that doesn't mean that you're first in line. In fact, when they rebook passengers, usually what happens is they rebook them from the most expensive ticket to the least expensive ticket. So by the time it's your turn, the flight that you might have been able to get on may be full. You could end up in a flight connecting in the opposite direction 18, 20, maybe even 24 hours later. Someone who bought the regular fare might get out on a direct flight the next morning. Someone who bought the expensive fare, the premium fare, might even get out that same night. Yes, you all got there eventually, but how you got there matters just as much as that you got there. Now, why do I tell you all of this? Because Medicare Advantage plans behave in the exact same manner. Let me begin by saying KFF is one of the most respected health policy research groups in the country, and they looked at data about who can actually change their Medicare coverage later. What they found is this: 9 out of 10 enrollees in a Medicare Advantage plan don't have an automatic right to switch to a Medigap plan. In their analysis, that's 22.4 million people. Now, I want to be really precise here. Those 22.4 million people can switch back to original Medicare. The question is, can they subsequently go get a Medigap policy, a Medicare supplement? In most states, the Medigap plan insurance company is allowed to ask health questions and decline coverage. Most people believe that Medicare behaves like your job's old health care plan. Every fall, you pick it up again, and your old choices don't follow you. Half of that is true. The half that is not true is the expensive half. So today we're going to walk through the choice you make around 65, Medicare Advantage or original Medicare with a supplement plan. I'll show you what each one actually is, what they cost, and how easy or not it is to switch from that plan to the other plan. And importantly, I'm going to help you get crystal clear about which choice is best for you. Let's start off with the rule that makes this decision different than your old health insurance decisions. When you sign up for Medicare, you get something called a Medigap open enrollment period. Medigap is just another name for a Medicare supplement plan, and it's the policy you buy that pays for the things that original Medicare doesn't pay for. That window is 6 months long, and here's the timing, straight from Medicare's own website. It starts the first month you are both 65 and older and enrolled in Medicare Part B. Notice what it's not tied to, your birthday. It's tied to Medicare Part B. So if you kept working past age 65 and stayed on either your employer's plan or your spouse's employer's plan, and that employer had 20 or more employees, your window has not started. It starts when Part B starts. During that 6-month window, two things are true. The first is that an insurance company cannot refuse to sell you a Medicare supplement plan. The second is that they can't increase your rate on that Medicare supplement plan based on your health. There is one exception that you should know about, and that is if you didn't have insurance for the prior 6 months leading up to the plan won't cover pre-existing conditions for your first 6 months on the plan. If you did have coverage, that waiting period goes away. Then that window we just talked about, no underwriting, no rate increases, closes. It does not repeat every year. Now here's the part a lot of people get wrong, something called the fall enrollment period. It's from October 15th through December 7th, and that is specifically for Medicare Advantage plans and Medicare Part D plans. It's not switching into a Medigap plan. There's no annual open enrollment for a Medicare supplement plan. There never was. So what happens if you try to buy a Medigap plan after that window closes? You very well likely will have to go through underwriting, which is the industry's way of saying you have to fill out health questions, and they can decline you based on your responses. Now, I don't want to be vague about this. Let me give you a strong idea of the big things that they look for. KFF read 15 real supplement applications from 12 major insurance companies to find out what these companies screen for. Conditions that can get you declined include Alzheimer's disease, cancer, congestive heart failure, stroke, and diabetes with complications. So can kidney failure. So can needing help with daily activities like bathing or dressing. So can using a wheelchair. So can taking more than 50 units of insulin a day. So if you look at that list again, it's not a list of rare conditions. These are the things that start happening to people if they haven't started already in their 70s. Now, there are websites out there that give you a percentage of people denied. Those sites aren't accurate because insurance companies aren't required to report that information. The last real government study that was done on this was in 1996, so about 30 years ago. So if someone gives you a precise number, they're making it up, or at least quoting very old data. What we do know is the 22 million and 9 out of 10 of them don't have a guaranteed right to switch from a Medicare Advantage plan to a Medigap plan. Now, why is this important? Because of what a Medicare supplement plan, a Medigap plan, covers. For doctor visits and outpatient care, original Medicare generally pays about 80% of the approved cost. You pay the rest. Hospital care works differently. That side uses deductibles and daily copays rather than a straight 80% split. Both share one feature. There is no limit on what you pay for your share. None. That is the gap that a Medicare supplement fills. And the most common Medicare supplement is Plan G. Basically, Plan G covers most of the difference in that gap. And let me make it concrete for you. Under original Medicare, the first time you go into the hospital in a benefit period, you owe a deductible before Medicare pays anything. For 2026, that deductible is $1,736, and it's not once a year like most deductibles. If you go back into the hospital after a long enough gap, you can owe it again. Does a Medicare supplement plan cover that? Yes. Medicare Plan G covers that $1,736 in full. It also covers the 20% original Medicare leaves on doctor visits, tests, and procedures. What you still pay in 2026 is the $283 Part B deductible. After that, very little. You can see almost any doctor in the country, no referrals needed, no network used, and I think something like 90% plus of doctors out there accept Medicare. And the cost, the most recent national figure I could find, comes from KFF using data through 2023. It puts the average Plan G premium at about $164 a month. Your quote will differ because it's now 3 years later, and that isn't region specific. That is an average. Two things to note: premiums usually rise with age, and you need a separate supplemental drug plan. Now, what is a Medicare Advantage plan actually? A Medicare Advantage plan replaces original Medicare with a private plan approved by Medicare. Medicare pays the insurance company directly to cover you. The plan has its own network, its own deductibles, and its own copays. Most bundle in drug coverage. Some have dental, vision, hearing. Some even have a gym membership. And the premium is often zero, beyond the Medicare Part B cost, which you have to pay with either option. But a zero-cost premium doesn't mean zero cost. You have to pay when you use the plan. Every Advantage plan has an annual limit on what you pay out of pocket. For 2026, the law says the limit can go as high as $9,250 for in-network care. The typical plan does set it lower. The average in 2026 is $5,421. Two other things come with Advantage plans. The first is networks. KFF found that Advantage enrollees have access to about half the doctors available to original Medicare in their area. The second is prior authorization, and this just means that the insurance company needs to approve your treatment before you begin the treatment. And that is the structural difference between the two. The fact is, original Medicare doesn't really have prior authorization except for a few pilot programs, but by and large, this isn't something you will see. Advantage plans use it routinely. In 2024, insurance companies made 53 million decisions, and about 12% of those were declined. That means that 88% of them were approved. But here's an interesting statistic. When the decline was challenged, 67% of the time, the insurance company went on and approved the treatment. So most denials that get challenged don't hold up, but that costs time, valuable time in many situations. Now, Let's put numbers on both choices. But before we do that, let me highlight that there is no standard Medicare Advantage plan. It's not like a Medigap plan where a Plan G is a Plan G. Medicare Advantage, each plan has its own rules to some degree. And the best way to look at this is in the 3 stages of retirement. Stage 1, you're over age 65 and you're generally healthy. For most people at this stage, you can assume 2 regular doctor visits and 1 specialist visit for the year. On Advantage, that's a $20 copay, then another $20 and $40, $80 for the year. On the supplement side, Plan G is, say, $164 a month. That is $1,970 a year. Add the $283 deductible and about $500 for your Medicare Part D drug plan. So roughly $80 against $2,700. Using straight math, Advantage wins by approximately $2,600. Now here's the thing about a Medicare presentation. Typically, you'll see stage 1, but they won't show you what happens at, say, age 78. Let's look at you at stage 2. You're 70 years old, and maybe you have diabetes and high blood pressure at this point. You have 6 primary care visits, 4 specialist visits, labs, and imaging. On Advantage, the copays add up to somewhere around $1,500 to $2,000. On the supplement side, you're still paying about the same $2,700, and the visits are covered. The gap has nearly closed. But notice what's happened. It's no longer about the numbers, it's about which numbers can you predict. Gang, Medicare can be confusing. It can be overwhelming. Ask anyone who's age 65 and older, and they will tell you that this is true. On this channel, we have 3 affiliate relationships. One is our trusted Medicare Partner Chapter. Chapter is the only national advisor that looks at and recommends every plan. They're totally free to you. It takes about 20 minutes of your time, and they save their clients an average of $1,100 per year. If this is of interest to you, give them a call at 440-703-1224 to see if they can help. Now, let's talk about stage 3. You're 78 years old. You have hospital visits. You have doctor visits. You have surgery. You have rehab. On Advantage, a year like that can push you towards your out-of-pocket limit. It doesn't automatically get you there, and plenty of people never reach it. But this is the kind of year that can. And the average in-network ceiling is $5,421, although a plan can set it as high as $9,250. On the supplement side, your plan is higher now. Let's say it's $250 a month plus the cost of your Medicare Part D drug plan. In the hospital stay, the surgery and the rehab are covered. So the choice that saved you money at age 66 cost you money at age 78. Same plan, same person, different year. And the big one, if you need a specialist that is out of network, you don't need to worry because there is no network. Now with all of that, why does every road point to Advantage? Here's why. You'll notice that the mail, television ads, and phone calls all point towards Medicare Advantage. There are reasons for that, and they're not sinister. MedPAC advises Congress on Medicare, and this past March they reported that Medicare will spend about 14% more on Advantage enrollees in 2026, more than those same enrollees would have received with original Medicare. That's about $76 billion. Then there are the agents. CMS sets a cap on what agents can receive from insurance companies. In 2026, the number is $694 for the first year, then $347 every year after for as long as you stay enrolled. Some states have actually gone around this, like California. The numbers are higher. It's $864 and $432 respectively. For supplement plans, CMS caps nothing. Those commissions are generally set by insurers, and they generally run smaller. Now, it's important that you hear this point. It's been my experience that most agents are honest people, but the system leans a particular way. And a system that leans a particular way produces results that lean that same way. Now, earlier, I said that going from a Medicare Advantage plan to a Medigap plan is hard. The reverse is not true. It's much easier to go from a Medigap plan to a Medicare Advantage plan. You can do it in that October through December window. Medicare Advantage plans don't use underwriting. Still, federal law does give you a few exceptions, and the insurance companies need to let you know about this. Let me explain what they are. Even though going the other way is hard, there are a few times where you have guaranteed rights, and these are those times. The most generous one is what's called a trial right. if you join a Medicare Advantage plan when you're 65, you have 12 months to try it, and if you change your mind, you can switch. If you switch, you have a guaranteed right to buy certain Medigap plans sold in your state with no medical underwriting. The second is a reversal right. If you dropped a Medigap plan to go try a Medicare Advantage plan, you have 12 months to undo that. And then the third, if your Medicare plan leaves the area, it ends, or you move out of the area, in many circumstances, you have the right to switch to a Medigap plan. A few states go further. Connecticut and New York require insurers to sell year-round. Massachusetts and Maine have their own rules. Minnesota added an annual enrollment window on August 1st of this year with a permanent surcharge for enrolling late. Everywhere else, if none of those rights apply to you, the answer is underwriting. So what do you actually do? Well, first begin by talking with a qualified professional who understands your specific situation, but you can begin by answering these 5 questions. 1. Can you absorb a $6,000 a year without changing your plans? If yes, Advantage costs are survivable. If that number would hurt, weigh the supplement. Next, do you travel or split the year between 2 states? Supplement plans work anywhere Medicare is accepted. Advantage networks are usually local. Third, do you have a condition already on the decline list? If you do, this may be your only shot at getting on a Medicare supplement with no underwriting or no rate increase. Next, are your doctors on the plan, or would you change doctors to save money? If the answer is no, this is a pretty strong indicator of which way you might be going. Check the actual network, not the brochure. Check it again every year. Fifth, what does your state allow? As I mentioned, in some states, you can switch to a Medigap plan anytime. Most of the time, you cannot. The important thing to note is that a Medicare Advantage plan is the right choice for some people. For others, it's a Medigap plan. But going in with your eyes wide open is supremely important. If you like this video, check out that video. The $9.8 billion Medicare subsidy just ended. Here's why. Also, don't forget to give Chapter a call if you have questions about Medicare, 440-703-1224. This is Jeff Schmidt, and I will see you in that video right there.